Guest is Dr. Bridge Bomby. He's been on the show well over the year. Of course, he's affiliated with Bakersfield Heart Hospital and Centric Health. And Dr. Bomby has been such a blessing to this show. He's a cardiologist by training. He's also a medical expert and a scientist. He understands and has been such a guiding light throughout this pandemic and has brought a level of sobriety to how we're looking at this through the good days and the bad days. And you remember we had some really bad days in California and throughout this country. We lost over 500,000 people this pandemic, and no, it's not over yet. We don't want to assume it's over. But having Dr. Bomby on has really given me access to top flight current medical information that I wouldn't otherwise have, and shared it to you. Let's get Dr. Bomby in here and we can pick his brain a little bit more. Dr. Bridge Bomby, thank you for rejoining the show, sir.
Richard, it's my pleasure, and I must say that we conclude this program with the degree of nostalgia, but also anticipation that your new setup will allow in-depth visits to serious topics that the radio show sometimes doesn't have the time component associated with it. And it's been my pleasure to walk the COVID walk with you over the last 14 months or so. And over the 14 months, Richard, we have persevered to adhere to science. We have pursued all avenues of knowledge. We have tried to maintain humility when the answers were less than obvious, and we have retained our primary goal, which is to serve the people who listen, to our community and to our patients. So I congratulate you on a wonderful show that you have had for an extended period of time. And as Bob Dylan says, change is coming, or something like that.
Something like that, you know. The times are a-changing. There you go. Dr. Bomby.
Times are a-changing.
Yeah, thank you so much for that, for your kind words. But really, it's been you that's allowed me. You said, yes, I'd be willing to do it. I'd be willing to come on to share my expertise. And if you go back a little over a year ago when we started these conversations about COVID, we were all in the dark, man. Nobody knew what this thing was, what a virus was, what the difference of this was. You know, the vaccine at one point was like a pipe dream. It was like, you know, can we make this happen? How long will it take? So to have somebody like you to kind of walk us through there, kind of an insider who knows medicine and knows how these things are developed and the protocol, that's certainly not what I would do, has just been invaluable. Let's start off the conversation today with this, Dr. Bomby. I came in here, I hadn't been in the studio in over a year, and it's spent a few minutes greeting everybody, people I hadn't seen for a while. I'm not going to name any names, but I saw a couple people who work here at the company, and we're catching up, and two of them surprised me, younger men, both men, and they're, you know, maybe around 40, late 30s. And I asked, did you get the COVID? Both of them said no. And I said, have you guys been vaccinated? And both of them said no, you know. And I understand that. I get the whole reluctance to the vaccines. But I wonder, I thought I should pose this to Dr. Bomby, because now we're starting to see, as the number of the demand for the vaccines diminishes, we're starting to get to the true, at least this is how I view it, the true bottom. What's the true percentage of Americans who are going to opt out, who are just going to say, you know what, I haven't gotten it at this point, I don't need to get it? And number one, does that concern you? And what does it say about a Western society that has been exposed to the science, has been told what could be, you know, the dangers of not getting vaccinated, but are going to kind of ride it out, so to speak? Does it concern you when people tell you that no, just not going to get it?
Absolutely, it does. So let's start from the beginning. The virus continues to evolve. And the newest iteration in India that has really wreaked havoc over there is also particularly aggressive against the younger people and the kids. thousands upon thousands, tens of thousands of kids have been affected, and several have died in India. The relative immunity that younger people have versus the older people still is there, but that relative immunity has been hollowed out as the virus evolves. So even when the CDC gave the mask mandate away 8 or 10 days ago, my concern was we are leaving out the best among us, which is our kids, exposed to danger. There was no reason to lift the mask mandate at the time they did. I would have much rather they let it be for another 4 to 6 weeks and vaccinate the kids. Since the vaccine has been approved for kids 12 and older, we want to make sure our kids, our future, is not compromised by our rush to unmask ourselves. I think there is a lack of responsibility in that decision making. That's a decision I did not concur with. The vaccine hesitants should also recognize that they're part of the solution. Every vaccinated person is a shield against the vaccine. They prevent the infection to themselves, and they prevent vulnerable people from being infected because they become the shield. And if we are not going to shield our elderly, which luckily have been vaccinated, at least a large number of them, and if we're not going to shield our kids, what good are we? Where is our basic decency? Where is the basic tenet? How dare we call vaccine hesitancy or vaccine denialism as analogous to patriotism? That's a backward notion. That's inversion of logic. So I really don't understand it. But the vaccine hesitancy has to be surmounted. Of the people who have been approved to get the vaccine, only 60% have had the vaccine. The 40% haven't had it. Then, as you add kids and more, so the first dose of the vaccine has been given to roughly 50% of the people. 37% or so have had both dosages. Richard, I worry that the low-lying fruits have been picked. Now comes the harder part. And people are going to somehow, either through their belief system or through their invincibility or their political or other cultural association, not get vaccinated would leave a large population of the country susceptible, and that will harbor the virus. The cycles will keep on occurring, and the new iterations can put us behind. So it's my continuous plea. It has been, please, we respect your invincibility, but do it for the sake of others. It's a notion that's totally incomprehensible to me. And when we use our personal liberties as the rationale for it, it really doesn't hold water. Because the personal liberties should, first of all, not be that sensitive and thin-skinned that you have to contrive notions that threaten your personal liberties. Personal liberties also come with an accountability and responsibility towards the society that you live in. You need to protect yourself. You need to protect the kids. You need to protect the elderly. The virus has killed way too many. Let's not be a tool that spreads its lethality and kills more people.
Well said, talking to Dr. Bridge Bombi. Dr. Bombi, did we, as we're starting to see in other countries, and you mentioned India where you were born, are we starting to see? We're starting to see some infections among younger people. I guess my question is, were we lulled into some sense of false security that younger people either couldn't get it, or if they did, it would be a really mild case? And now that we have large segments of the older population vaccinated, we're starting to see, maybe we got it wrong. Did we get it wrong, or what happened there? I just remember a lot of talk early on about, it was in the debate about opening the schools, that well, open it up because the kids' immune systems are stronger, and if they get it, it's just going to be like a mild cold. Did we get that wrong?
I think it's the evolution of the virus, because initially it was selectively more dangerous to the elderly. But the new iterations have become a little more lethal, a little more efficient in infection, and thus attacking the kids with greater affinity. Even when the elderly and people with comorbidities were more exposed, I kind of wondered if the rationale that younger people are using, that, it only affects the elderly, is a responsible rationale, because there is no chivalry in hiding behind a grandmother's death. The youth has a responsibility both to the elderly and to the young. For the youth to be arrogant is not a proper behavior. That part didn't sit well with me at the time and doesn't sit well now. Other thing, Richard, I've seen is initially when we started vaccinating, there was a demand and supply disequilibrium that demanded that every last dosage in the vial be injected in the person.
I remember that.
Because otherwise it would go waste. Now, with increasing vaccine hesitancy and large amount of supplies in this part of the world, we need to commit a vaccine heresy that we couldn't do that before. We may have to waste some dosages to inject as many people as possible. They may have to come up with, actually they're working to distribute the vaccines in smaller vials, so not the wastage is limited, but we have to put all hands on deck to make sure we win over vaccine hesitancy, at least vaccinate every willing human being. And also the smaller vials will increase portability in smaller villages and small places where smaller populations are. We don't have to waste too much vaccine if we are able to distribute it in smaller vials. So the heresy of vaccine wastage has to be lived with, because pragmatism demands it.
Yeah, right. You've been a vocal critic of the way that this vaccination program rolled out, and that you've said, why didn't we use doctors' offices? Why couldn't I go to my primary care physician, Dr. Raj Patel, and get the shot there? That instead it was done the way it was done. And I mean, I know Centric had, you guys had an operation both at the Heart Hospital and at your Medi Center, but you couldn't go to your normal doctor. If we're looking at booster shots or a new shot, will those be available through our normal relationships with our primary care physicians, or will that be rolled out much as the first vaccine was?
These are decisions above my pay scale, but it doesn't make any sense for us not to use the existing infrastructure of pharmacies, doctors, hospitals, urgent cares. It's intuitive to use those, but they went the counterintuitive route. I hope next time around they use the existing infrastructure for efficiency reasons and for overcoming the hesitancy reasons.
God. Dr. Fauci Dr. Fauci, the Fauci's on my mind. Dr. Bombi. Dr. Fauci, I know. Well, you are my Fauci anyway. Fauci has come under such criticism from different political sectors, and I understand politics. I get why that he's become a political target. But let me ask you, when you see Fauci being attacked as being a tool of one political party or the other, or of the administration or the previous administration or whatever it is, how does that strike you? And do you believe that he has he has earned this criticism, or that we should give him a break?
I think Fauci has become a trigger point for both sides. The one side adores him for reasons that don't exist, and the other side abhors him for reasons that don't exist. So he has become really a flashpoint between the two opposing sides. As I was disappointed at the onset of the pandemic that our people whose job is to seek out pandemic before it becomes a pandemic did a lousy job. They did a lousy job in the first 90 days, and that's Fauci's fiefdom, and people like him. I thought they needed to do better. I hope they do better. And Fauci has a brilliant career going through HIV and others. But I think, like everybody else, he has his good points and his bad points. One side only sees the bad, and the other side only sees the good. But that's the way we are. We are a polarized country, and the trust has been decimated in this country. That's the number one enemy we have. The enemy is within. We hate each other.
Oh man, yeah. The trust has been a victim in all this. Final question here. What should we expect here over the next few months? Maybe say the next quarter. We're in a stance here where things are starting to open up. People are really anxious. Had a high school graduation at the local football fields. I mean, people can feel the energy and feel the optimism, so to speak. But I know that this battle is not over. What would you expect for the next 90 days?
I would like to believe that things will continue to improve, that the worst of the pandemic in this country is behind us. I like to believe that the durability of immunity is much longer than what we give it credit for. I like to believe that a booster shot will not be necessary for a couple of years. And if those parameters hold, we can even make do with lesser number of people having participating in the herd immunity. But my hope is more people participate, and the trajectory of opening continues, and we go back to 2019 in terms of our behavior and lifestyle, and we have a replay of roaring 20s of a century ago.
Got it. Okay, Dr. Bridge Bombi, he's been such a rock for me, Dr. Bombi, and you and I are not done yet because I'm already talking to Dr. Bombi about being on the podcast as we come up here. But Dr. Bridge Bombi, thank you again, sir. I don't think you should ever underestimate the contributions you have made by being on this show, by sharing your knowledge with this community in a really, really perilous time. I want to thank you for that, sir. I appreciate that.
Richard, it's been my pleasure, and our job continues, as you said.
Excellent.
So thank you for allowing me to participate in this endeavor.
Okay, thank you. Dr. Bridge Bombi, everybody, of Centric Health News.